Okay, while we are settling down, let's do an open house session. And to head the open house session, may I call upon Dr. Sundar to join me on stage. Dr. Manju Aggarwal, Harshit, Naval, join us on the open house. Yangchen, please join us on the dais. So this is a moment where we ask the audience, anybody has any questions, you can ask the doctors or the patients seated on the dais. We have about 15 minutes for this session. So if you have a question, just raise up your hand.
There are no questions. I think Marian will ask all the questions. But I think before we, Marian, I think we should introduce Manju and all the others.
Doc, can you please do the honors? You're the best person for it.
Let them introduce. Everybody can.
Introduce themselves.
Yes.
We introduce.
Ourselves. I am Dr. Sundar and I am from Bangalore. I'm not nephrologist. I'm part of Kidney Warrior Foundation.
My name is Manju Aggarwal and I'm a nephrologist and I'm here because Vasundhara ma'am called me and actually Dr. Bhaumik called me. So I work at Artemis hospitals as the Chief of Medical Services and I head the nephrology department.
Hi, good morning everybody. I'm Harshit Bhatia. I am post-transplant, 13 years now. In fact, March 18th, I'll cover 13 years of my transplant. And I was a part of Kidney Warriors Foundation since the start. So now whenever Vasuman tells me ki kuch karna hai, contribute, I'm always ready. So pleasure to be here.
Hello everyone, my name is Naval Joshi. I had my kidney transplant back in 2015 and transplant has changed my life, changed my perspective. I'm living a healthy life because of a good transplant. I am, Harshit, I am with Kidney Warriors Foundation since 7-8 years and been trying to, help in whatever initiatives they do.
And Naval is also a new daddy, by the way.
Congrats.
So, hello everyone, I'm Yangchen Dolma and a post-kidney transplant patient for the past 25 years. I have completed 25 years and under the guidance of my doctor, Dr. Bhaumik here. So, I'm following up with Dr. Bhaumik at AIMS. So, this is it and I'm a part of Kidney Warrior Foundation since 6 years. Thank you so much.
Yangchen, I knew so many things about you, but I didn't know that you're a 25-year transplant patient. Yangchen is also a nurse and at the AIMS hospital, and she gives back a lot to the community through her professional service. So that's the team on the dais. So do we have any questions first? And we're not really going with any kind of format. We can just go with the flow. Our chief guest is left, so everybody can relax.
Hemali and Anil Hemali has got a question. Mike there, please, to Hemali Ajmera. Incidentally, Hemali is a transplant recipient and she has, and her husband Prashant sitting there. Then a lot of work on the legal aspects. They have something called One Nation, One Law, domicile, all these have been sorted out by Hemali. And the most important thing is any legal issue with transplant, I just have to call them. Anywhere in India, they do pro bono service. And I think hats off to them, because one thing which is most challenging as a nephrologist is not the medical aspect. I can treat anybody. The law is what is challenging, and law is what is preventing us from doing more work. So when we have lawyers like Hemali and Prashant, it makes a difference. Hemali, please go ahead.
I have a question for all the nephrologists on the dais and in the room. What we have been talking since morning is about, when we talk about transplant, it's mainly live donation, right? And as nephrologists, you consult the recipients, the donors, and you tell them. We all know the statistics of deceased donation in India, only 0.82. That means less than 1% in 1 lakh population is donating. As nephrologists, how much do we contribute towards increasing the deceased donation pool in India?
I think it's a very important question. See, as a nephrologist, for us, for me as a transplant nephrologist the last 40 years, to me, any donor is okay. With disease donor, live donor, xenotransplant, it's okay. You know, the problem I have is, I know I was telling somebody just many years ago, when the organ transplant law came in to certify brain death, many of my neurosurgeon colleagues were not even wanting to have coffee or tea with me till Anil's brother Arjun, who is a neurosurgeon, had transplant and the things changed. Because very few neurosurgeons actually want to support this because they feel that they failed in their duty. Or they feel that if they certify brain death, their practice will go down. And then you have the media also talking bad about organ donation. We had this problem in Kerala, saying that somebody has been certified brain dead, even though they are not brain dead, for the sake of organ donation. So we have a lot of myths. So we need more the legal and also the patient community. I think more than nephrologists, I think the public have to do it. We need VIPs to do it. Like eye donation was not there. We were getting eye, you don't know, 30 years ago from Sri Lanka till Aishwarya Rai came and said, I am an or cornea donor. So like that, we need that sort of facility. I think then only it will work. I'll request Manjuri to
So, the deceased donation, the problem is that concept doesn't exist in the public's mind. So, whenever, and to my understanding, there needs to be pre-formed knowledge. According to me, a school chapter, like there is this dispute about corruption chapter in class 8th, that should be changed to organ donation. The concept of brain death does not exist. People think death is cardiac death. So that's where I think we need to start teaching school kids. So when they grow up and the parents and everyone, unless there is a preformed notion about brain death and organ donation, 2 days ago, I mean, that woman is still alive. We have a brain dead person in our ICU. The father is retaliating so badly. He's not even accepting brain death as a death. He thinks this woman will get up and walk about. So that's the biggest hassle. So all the hospitals in today's times, any potential brain dead or a real brain dead, we try to talk to the family, but we don't want a ruckus in our hospital. We don't want to be blamed for stealing organs. All right? I mean, we are not going to eat up those organs at the end of the day. We'll give it to some patient. And who gets the bad name? The hospital, the doctors. कि doctors हमारे organ चुरा रहे हैं. I'm sure at least 90% of you would agree this is what the dying patient or the family says. So somewhere education starts at a very preliminary level, and maybe kidney warriors can do it. Look, when doctors do it, it's not accepted well. Let me tell you, our vested interests come. I may not have a vested interest, but it's interpreted and extrapolated, as a vested interest. So it's a neutral body who can do it. Noto is trying somewhere, but how much can Noto do? So it has to be in the public's
On
mind.
that note, about what...
As you were talking to Emily about, you know, my own parents, cornea I donated my mother's body for research. Anil also did the same thing. I mean, we did do that for research. So we are trying our best, but as Manjuri said, I think we need everybody, all stakeholders to be involved.
I have a question for you, Himali ma'am. So before you ended up with kidney disease, you were an adult, right? Did you know about organ donation? Please give this answer in all truth, honestly. Very briefly. So that's the problem.
Yes, but what I want to say is that yes, I knew very little, but after I had my transplant, for the last 3 years, I'm completely dedicated myself to. No, I understand what you're trying to say, but I'm just telling you that there has to be a motivation, and I'll tell you how I got that motivation, because my nephrologist talked to me about it. So that is one point I'm telling you. So that somebody has to light the spark.
I agree. I think
It has to be conveyed to normal, healthy, walking, talking people.
I think we have a specialist over here, Dr. Manju.
They will do it.
We have Rita over here. I think she's published a paper also on this.
Yes. Let me tell you, I am Dr. Rita Dar. I did PhD from Jawaharlal Nehru University. I have worked with Ministry of Health and Family Welfare, what Madam was talking on Priya Patel ji. I have seen, I'm national assessor also, I have seen what is happening at the grassroots level also. But talking about brainstem death, it is not brain death in India. We diagnose brainstem death. The criteria are different. In different countries, we have adopted brainstem death criteria of diagnosing this death. And it is not every doctor can diagnose this death in all the hospitals. And not every hospital can diagnose this kind of death. You should understand that. There are only 1,200 hospitals, almost 1,200 hospitals all over the country in India. They can diagnose this death. It's a team of 4 doctors that have to diagnose this death. So not each and every doctor who are sitting here, they can diagnose this death. And it is a legal committee that diagnoses this death in these hospitals. And not many brain dead donors are there all over the country, even in these hospitals. If we see that, I think there are only 1,200 brain dead donors that have been diagnosed last year, and they have, donated organs. So that means almost, if suppose all kidneys were healthy in a healthy way, 2,400. In overall, globally, you may be thinking crores and crores of transplants are taking place. No, it is not that. It is only it is less than 2 lakh transplants taking place all over the world. So better take care of yourself. Prevention is the best way to prevent this disease. Don't think that dialysis can help you. Don't think that, you have to prevent, not only prevention of disease, even if you have to prevent this, progressing this disease to the 5th stage where you need a transplant. So even if we, compile all these, resources of all the world, we will not be able to get so many donors. There are only 45,000 or 50,000, not less than 50,000 brain dead donors all over the globe. So prevention is the best cure.
Thank you, Dr. Rita. Since we're running short of time, I think we'll need the answers to be really short. And post the next session, we're going to have lunch break. So those of you who want to catch up one-on-one with the doctors, you're most welcome to do so. But since we spoke about organ donation, I'd like to mention that we have the Rotary Club of Organ Donation present over here. The Rotary Club of Organ Donation is that group of people, Hemali sitting down, and then we have Dr. Sundar. And those of you who want to be a part of this movement, I'm going to request you to kindly meet them during lunch and have a conversation. We invite doctors, patients, caregivers, be a part of this movement where we are trying to work together. Okay, I'm going to ask Yangchen. There's a question that's come in the group from the patients, so I'm going to give it to you because I think you're the right person. What do I have to watch out for a long-term survival for post-transplant? That's exactly what they've written. From a patient's perspective?
Okay, so what I'll say is it's very simple, like keep your life simple and please follow your doctor's advice and never miss your follow-up. So I usually go 3 monthly follow-up still. After 25 years also, I do 3 monthly follow-up with Dr. Bhaumik. So keeping life simple is very important. I don't think we need to mess up with everyone. And you don't need to be like, I don't know, be with this social media and all, so many things are happening, but I prefer to keep myself very simple and focused, and I try to divert my attention towards positive stress rather than, the usual stress people are taking. So that's why I started as a GNM nurse. Now I am doing my PhD just because I wanted it to keep, engaged with a positive stress.
Thank you, Yangchen. Okay, boys, one of y'all can take this question. Regarding urine output, what happens when the urine output starts dripping? If you don't understand the question, then Dr. Sundar will have to translate this question, but...
What happens in the post-transplant?
I'm not sure which stage this person is in. It's come from Rakesh Kumar.
You said dripping versus dropping. There are two differences.
Maybe
dripping is when your pants get wet or your skirt gets wet. That is dripping. Dropping is urine output drops. There are many causes for that. A lot of people think that less urine means kidney failure. You must also understand passing more urine also is kidney damage, kidney failure. This many may not be aware of that. So that's important.
Okay, I'll go back to the boys on stage. Naval, you've been on dialysis, right?
Yes, for 2 months.
For 2 months. Harshit, you? For 1 month. You're not qualified to answer this question. Okay, let me give you another question. Can you, I'm not asking them that question itself. So, can you tell us a little more about your post-transplant life? I think, Naval, you run an organization and you've been a testimony for many people to live life post-transplant. Can you share something on that?
Look, I think with any illness, the biggest game is your mindset, right? If your mindset is positive, you can, because as far as I have understand, your medicines can only work if you're very positive about life, if you are willing to, live a happy, healthy life. People ask me how to change the mindset. It's all about, so I'll give you a very short story of mine. When I had a kidney failure, I was working somewhere. Because of the kidney failure, I thought, boss, agli baar kidney failure hua to job to jayegi. So I started a company. I ended up forming a company. I run a company in 4 countries. We do more than $1 million business every year. This is all because of kidney transplantation. So for me, kidney transplantation has been very good. And now I live a very relaxed life because I know next time if I get a failure, I have everything planned and sorted, right? Obviously, there are many things that I cannot plan in the disease, but at least financially, I am well stable. Mentally, I am stable. I know how to, tackle things. So I think सारी problems बुरी नहीं होती. It's just that आप कैसे उसके देखते हो. For me, transplant has changed a lot of things. Plus, I think it makes you very brave. Once you go to the ICU, once you go to the transplant table, उसके बाद लगता है कि यार इससे बुरा क्या ही हो जाएगा life में, right? And mindset आपका change हो गया, so then तो life is very easy and very happy.
Thank you, Naval. Okay, the question on dialysis, since I didn't mention it, was what would you, if a friend was on the stage of dialysis comes to you and ask you a question, do I do hemodialysis, do I do peritoneal dialysis, what is it that you will suggest? I know you've only been on dialysis for 1 month, and I'm so happy it was only 1 month, but if you go back, what would you suggest? And if you don't know the answer, that's okay.
Yeah, I think I'm not qualified to answer that, but I had hemodialysis.
Yeah.
Kamal can answer that.
Kamal, what would you suggest to this person if he's your friend? Yeah.
I wouldn't say there's any one particular type of dialysis that's the best. It's like asking which is the best ice cream flavor. Some people like vanilla, some people like chocolate, and some people like a third flavor. So I would say read up as much as you can about all the modalities, possibly talk to patients who've been through the different modalities, and then take a conscious decision in consultation with a nephrologist.
Okay.
I think believing your doctor is the best thing, right? Because when we enter this journey, we have no idea. Not everybody can read that much. So for me, in this whole journey, I have believed my doctor that whatever decision they are taking on my behalf are right. And I think it also works, right? So if they choose HD or a PD or a nocturnal, right? Obviously, you can ask them questions, but you have to believe that they are doing the best for you.
Yes, right? That trust is important.
I think that is the key. 2 things I think is that being positive. I always say if you smile, your kidney smile, your nephrologist smiles along with you, and you are married to the nephrologist. That is the way I function. All my transplant patients are married for many years, 40 years. I am like a family. I think that is the key to success on both sides, as a nephrologist and as a patient.
Doc, I'll tell you what I tell patients when they come for counseling. How do I choose my nephrologist? And if they're married, I'll say, hey, just decide who you want to have an extramarital affair. And both of you have to love him or her. That's the only thing I say, because this is going to be a lifelong journey of 3 of y'all. So just choose it like an extramarital affair. That's it. And when we spoke about dialysis, I don't know, Kamal, if I'm using the right term over here, but NephroPlus has this holiday dialysis. So I'm a caregiver, so I have traveled across the country, and my holidays are normally minimum 2 weeks because I have to take my husband there and get him dialyzed, and 50% of the days goes on dialysis. But I think that initiative is a life-changing initiative for patients on dialysis to really celebrate life. So thank you so much for that, Kamal. Dr.
Marian,
Jha? Okay.
sorry, here.
Yeah, yeah.
Actually, you asked me the dialysis question. Let me answer transplant. And I had a huge life ahead of me, the whole career, the whole life, what to do, how to do. And the only option for me was, I saw that movie during my recovery phase, Shawshank Redemption. Either you get busy dying or you get busy living. So I chose to get busy living, and I thought, okay, maybe there are some things that I can do in my life that will help me make this easier for me, because we are already fighting a battle. So how do we make this easier for ourselves? I also opened my own marketing agency. It's been 8 years since I have been doing that. After that, I wanted to study even more. So I went to London, I went to Oxford, I studied writing therapy. So now I'm helping other people have a positive mindset around their life, even if they are going through any distress, any physical, mental distress. So I think वही चीज़ है कि लाइफ में चॉइसेस होती हैं, कुछ हेल्थ हमारी चॉइस में नहीं था, लेकिन बाकी चीज़ें जो है वो माइंडसेट से मेरे हिसाब से हेल्थ भी कंट्रोल में चल रही है.
Thank you, Ashrat. Dr. Jha, did you want to ask a question?
No, I didn't want to ask a question, but I had, just because I've been around a long time and I've seen this whole paradigm, just a few thoughts to offer. Chronic kidney disease is one of the most intractable diseases that we can have, right? And once you have it, you're going to live with it for the rest of your life, whether or not you are on dialysis or transplantation. So please get to know your disease. That's the most important advice I would give. So while I appreciate your point in believing your doctor, but ultimately you are primarily responsible for your own health. And for that, you need to gather information. Your doctor is one of the most important sources of information, but then you yourself, being a knowledgeable person, being someone who can differentiate right from that, they don't immediately face any prejudice. I think the question that was, the point that everyone would make if you talk to nephrologists, how a patient says don't do this or don't do that to someone else, and thereby influencing and maybe starting a cascade which then goes through the entire hospital chain. That often derails a number of programs, a number of initiatives that institutions take. So I would, and similarly, so that's why the question kind of alarmed me. What would you choose if you were to develop kidney failure? And Kamal said correctly that everyone loves a different flavor. You don't have to love your treatment necessarily, but better you do love your treatment, because that treatment is going to stay with you for the rest of your life. But choose in an informed way. Don't fall prey to prejudice. For example, PD करने से infection हो जाता है. That's a very, very common myth which is perpetrated heavily, not only by patients, other patients, but their caregivers, some doctors also, I have to say, right? So just a bunch of things, and there are lots of myths about doctors, and you will hear stories from people who you think should know better, but often they don't, right? They don't know what they should be saying, and the amount of information, what is evidence-based, what is not evidence-based. I can tell you again, this is perhaps not something that many of my nephrology colleagues would like to hear, but the practice of low value care is quite rampant. And so the kind of prescription that many patients go home with it contains a number of elements which are what we call low value care, in the sense that care that they get really doesn't give them anything in return, but can cost a lot and can impose other kinds of burden, like just taking too many pills or having to spend money to pay for all of those conditions. So again, as much as possible, I think this is where groups like the Kidney Warrior Foundation really become important, because this will probably be the best source of information you can come to. You can come to this group, and this group knows how to filter bad from good, wrong from right, and so on and so forth. And if you but you will want to connect to your peers in the patient community, in the caregiver community, perhaps they can connect you to the people who can give you some sort of balanced information, evidence-based information that you can use in your own life in making eventually informed decision. But please do remember that in the end, you have to really be comfortable with whatever decision you make.
Thank you very much, Dr. Jha. When Dr. Jha mentioned that point, in the Kidney Warrior Foundation, we have something called the mentorship system, and I think that's the biggest strength for the Kidney Warrior Foundation, actually. Over there, when a patient has a question, especially when they are new to the journey of CKD, they post the question, and what we do is we tell them what are the different things that they can go and ask their doctor first. And no solutions can be given within the groups, but what you should be going and discussing with your doctor and broaden the framework for that conversation. So that's something that I take great pride in saying for the foundation. We had one question from behind. I think it was a little boy's father, if I'm not mistaken. And then we'll come to you. Sorry? It got covered up. Thank you. So we'll go with one last question. Who wants?
What my 3 years of an experience that my wife has gone through the kidney is that when you are a recipient or a donor or a family, when you get cured, speak up, share your story. Because every story, what you have gone through is an inspiration to the another patient. You don't have to be a Mahatma Gandhi to inspire somebody, because other patient will see that this can happen to not only to me, but it can happen to others as well. The second aspect is that legally, because I'm a lawyer and we face the legal challenge. And believe me, every nephrologist, every doctors, and even lawyers say no to that it will not happen, because we are a Canadian citizen and we were denied domicile certificate to register in a cadaver registry. We took up that case with the help of the friend Anil here, and we won the case in Gujarat High Court, and that was the end of the case for me. But then we realized it that this is not my problem, but it's a national problem for all the CKD patients living in India. We took that as a public interest litigation. We won the case, and as you all know, the domicile certificate was removed because of that particular case. The reason I'm sharing this story is that why it was done, because patient spoke. It was a patient speaking. I know at least 6 or 7 nephrologists, associations, government people who has a direct connections with the ministries. They spoke and it didn't change. Why? Because they saw that they have a vested interest, as the doctor said. So they have a vested interest, it will not change. But it will change when the patient speaks, sufferer speaks, customer speaks, consumer speak, it will change. If you go to our website, there are about 35 cases are there related to the organ donations, live donations. Permission is given by the court to do the donations. All the cases are positive in favor of the patient. So my point is that you speak up, you share your stories. If you have difficulties, take a legal actions if necessary. So that's all. Thank you.
Thank you so much, Prashant. We would love to continue. Okay, Doc, you want to say something?
Yeah, there was a point made about organ donation. How many of those who are having kidney disease or on dialysis or have had a transplant have pledged to donate their organs after death? Have all transplant patients pledged to donate their organs after death? This is a message that we should send, because this is something that is of importance of public awareness. When any patient comes to me to register for deceased donor transplant, I tell him, have you pledged your organs after death? It's only then that you can get an organ.
I think that's a brilliant point, Doc. And I think we should make it mandatory. Post-transplant people have to pledge their organs. But on that note, since we're running short of time, thank you so much, doctors. Thank you to my friends from the Kidney Warrior Foundation. And if you have more questions, you can meet them on a one-on-one session during lunch.